Hi, I'm Mark Thompson, External Affairs Officer with the Medical Society of Delaware, and today we're joined by Ardis Dee Hoven, MD. Dr. Hoven is an internal medicine and infectious disease specialist in Lexington, Kentucky, and she was elected President-elect of the American Medical Association in June of 2012. Dr. Hoven has been a member of the AMA Board of Trustees since 2005. Dr. Hoven, welcome to the Medical Society of Delaware.
Well, thank you. I've had a great time, got to have some wonderful conversations with folks, excited to see the work you all are doing, and look forward to seeing how things progress.
Well, thank you. I have just a few questions for you. I'd like to ask you a couple questions. What, from your point of view, what are the most critical challenges that the healthcare system faces during this period of fundamental change?
Well, this is a crucial question, and I think it's got many answers to it. But I think as we move forward, there are several main areas. First of all, we have to address the issue of Medicare. We have to address the challenges of Medicare payment and delivery change that will inevitably occur because physicians in this country cannot continue to face the destabilization of their practices going forward. In addition, we have to be sure that Medicare is around for future generations, so we've got to be sure it is strengthened in years to come. That's a big one. We've got to help our states and our physicians who take care of Medicaid patients be able to do that in a way that allows them to get the payment that they need for providing the care that they want to provide. So stabilization of Medicaid in the states, maintaining those safety nets, huge, huge issue. Workforce issues. People bring this up all the time. Can we, in fact, afford to take care of all these patients? Well, the interesting thing is there still are patients. They're out there right now. They're really not new patients, but we have to look at workforce issues going forward. It takes 7 to 10 years to grow a doctor, and we have to work and understand how care can be delivered, how teams can be used, how we can most efficiently use physicians in our country in the best possible way as leaders of the healthcare team. And then graduate medical education. I am very concerned about GME education. We've got to have residency and training programs for young physicians as they come out. This is another great issue. So these are some of the top ones that we're going to have to deal with.
Sounds good. In terms of goals, what goals are you setting for yourself and also for the AMA for addressing these challenges?
Well, again, thank you for that question. My goals are those of the AMA because I think they're very closely linked, and I've been such a part of the AMA and its growth in years, the most recent years, but also as we've looked at our new strategic plan, and I am very supportive of these. And I'm going to start first with the whole issue around delivery and payment reform. I am a firm believer that physician happiness and physician satisfaction in the practice of medicine is key to great quality health care and patient satisfaction and happiness as well. So as we develop our programs around payment and delivery, they not only impact Medicare, but also in other areas as well. This is going to be a huge issue for us. We've got a huge team put together helping with this. It's exciting. I'm looking forward to seeing what is going to happen with this. The next is in the area of medical education. As we look at one of our main strategic foci going forward, it will be medical education. You know, AMA owns medical education since the Flexner report. So we must then make change happen. Everyone agrees change has to occur. Let's look at, should it be competency or time spent in the learning process? What are the things that need to take place? And we're looking at ways of doing it with expert advice from a group of people that are going to help us. Medical school deans are excited about this. This is going to be a great thing going forward as well. I would also say that medical education is going to extend to graduate medical education as well as continuing medical education for physicians. So we don't limit ourselves to med schools. Simply, we're going to do the whole spectrum. This is a moonshot. This is a big deal. And then the third one are health outcomes. We talk about in this country how the United States sits at the bottom of health outcomes, yet we're sitting in an environment of extraordinary talent, incredible technology, all these physicians who are superbly trained, but why are we having the problems we're having? We're going to attack this. We're going to look at it. We're going to involve our physician colleagues in helping us do that. It's a continuation, if you will, of much of the work that started at the AMA in quality, the Physicians Consortium for Performance Improvement, for example. Let's build on the work we're doing. Let's improve health outcomes. Let's pick some things that we can make better in this country for our patients.
It's certainly an ambitious agenda. So
I've always been ambitious.
What are some recent examples of how the AMA has used its prominent position and voice really on behalf of patients and physicians?
Well, there are quite a few of them, but for example, the ACOs, the Accountable Care Organization, when the first rules came out on that, physicians were in a bad place because it was not going to be efficient for them. It was going to be expensive. They were going to have to join up with hospitals. What the AMA, as a strong voice for medicine, was able to do was say, no, this isn't the way this should happen. Let's help physicians do this. Give them money up front to establish these programs, these ACOs. Don't make them have to deal with a hospital system to do it. Get rid of a lot of the excessive things you're requiring, and thus that has improved. The work on ICD-10, not perfect, but we've gotten another delay on ICD-10, another role the AMA has played. There are a host of regulatory issues that most physicians in this country don't even know that we have addressed for them, gotten rid of. A lot of the hassles around regulatory burdens that we continue to work on, a lot of these around health information technology, a lot of those sort of drop-dead deadlines that everybody's supposed to have to meet. So just some examples of how the AMA every day is a part of their advocacy working on behalf of physicians.
You mentioned about the Affordable Care Act. If you would, tell me a little bit about what are some of the steps that the AMA is taking to improve the Affordable Care Act, and particularly also that's kind of a two-part question. Also, the second part of that is what issues are left out there that need to be addressed that the AMA will do all together.
The Affordable Care Act was a good first start, not a perfect first start, but at least it began to move the pendulum in the right direction to get the uninsured covered, to get rid of some of the things that we don't like. For example, people with pre-existing conditions not able to get care. Caps on lifetime experiences in certain health situations. For me, those were intolerable, and for my patients, I suffered with them when those would occur. So the Affordable Care Act opened up the door for us to see improvement. When the Supreme Court ruled in favor of individual responsibility, that again solidified a lot of those pieces of regulation that have already been in place. Again, the caps, allowing kids up to age 26 to remain on their parents' plan, helping with a lot of the things about Medicare in terms of prevention and wellness for many of our seniors. So there are some really good things in the Affordable Care Act. But what's not in there? There was nothing in there about Medicare payment reform or the SGR. We know that we have to do it. The members of Congress on both sides of the aisle know they have to do something about it as well. Medical liability reform. We keep plugging away. We keep seeing that our work is important. Our advocacy work at the state level, our work at the Advocacy Resource Center with states and specialty societies has made a huge difference. We have to keep hammering on that. And then thirdly, what's in the legislation is something called IPAB, the Independent Payment Advisory Board. Political appointees, many of whom may not know anything about health care, deciding that if Medicare payments are too much, they're going to slash. Again, this is an ineffectual way to do what needs to be done for this country and the citizens that get their care through Medicare programs. So we've got to get that piece of legislation out of there.
Speaking about Medicare, from your perspective, is there a real chance for Medicare reform? Right now we've got the divided legislature, but we have the election year. Yeah. So what's your take on that?
It's going to be a tough one. Both sides of the aisle, bipartisan support. We've got to change the Medicare payment system. They don't know how to do it, and basically have come to the AMA and said, help us figure this out. Now, in the short term, what's going to happen over a lame duck session, nobody knows. Will they try to put a patch on? What are they going to do? The politics will be the driver on this. We're going to have to wait to see what happens after the election. But it will be a lame duck Congress. Now, having said that, we are in the midst right now, the AMA, working with states and specialty societies, planning a approach to this which will meet